President Trump just dropped a major announcement on Truth Social, and it's sending shockwaves through the pharmaceutical world. He's promising that prescription drug prices in the US will be reduced by 30% to 80% almost immediately. This could be a game changer for millions of Americans struggling to afford their medications. So what exactly is the plan? Trump says he'll bring back a controversial policy called the most favored nation rule. This means the United States will pay no more for a drug than the lowest price paid by any country in the world. If Germany or Canada pays less for a medication, the US will match that price, not a penny more. He plans to sign the executive order at 9 a.m. Monday morning. According to Trump, this will be one of the most consequential executive orders in American history. But this move is more than just about cost. It's also about reshoring, bringing drug manufacturing back to the US. The goal is to reduce dependency on countries like China and India, where many active pharmaceutical ingredients are currently made. Trump also hinted that this plan may address pharmacy benefit managers, the middlemen who negotiate drug prices but often drive costs up behind the scenes. These companies play a huge role in setting the final price Americans pay at the pharmacy counter. There may even be tariffs involved. Trump is reportedly considering placing tariffs on imported drugs, which were previously exempt. This could force more manufacturing to come back home, but it also risks shortages, especially for generic drugs. Experts say the policy could lower Medicare Part B drug costs, especially for medications administered in doctors' offices. Under Trump's 2020 plan, Medicare would have saved $86 billion. That rule was blocked by courts and later revoked by President Biden. If this new executive order follows the same model, it could lower out-of-pocket costs and premiums for seniors on Medicare. But there's also concern that it could limit access to certain medications if drug companies refuse to cooperate. Some analysts are skeptical. They say Trump tends to talk big on drug pricing, but actual policy outcomes have been mixed in the past. Meanwhile, Big Pharma is pushing back. Industry groups are already calling the policy dangerous and claim it could hurt innovation and make the US more dependent on China. Still, with election season heating up, this move gives Trump a bold platform on healthcare and cost of living issues. Will it work? Will it survive legal challenges? And most importantly, will it actually help everyday Americans afford their medications? We'll find out soon. Monday could be a turning point in US drug pricing policy.